What is an inguinal hernia?
Inguinal hernia is an abdominal wall defect in the groin area. In this disease, abdominal organs like intestines or omentum may change place from intra-abdominal side to the underskin area, and patients may define a bulging over the groin area.
What causes an inguinal hernia?
The reasons for inguinal hernia are mostly associated with the patient's lifestyle. Patients who have a hard work, like working in the lifting areas, and serious coughing problems, and the things which increases the pressure in the intra-abdominal side are the reasons for occurring of an inguinal hernia. And very rarely we can see some congenital inguinal hernias in our practice.
How is an inguinal hernia diagnosed?
The first step for diagnosing an inguinal hernia is physical examination. Most of inguinal hernias can be detected with physical examination, but to be sure about the diagnosis, an ultrasonography check or MRI scan can be done for final diagnosis in this disease.
Is inguinal hernia surgery a major procedure?
All the procedures can be defined as a major procedure, but if you categorize it, it's possible to perform an inguinal hernia procedure in an ambulatory clinic. When we compare the other intra-abdominal surgical techniques, we can say that inguinal hernia repairs are easier surgical techniques.
What is inguinal hernia repair surgery?
Inguinal hernia repair surgery can be performed for the patients who diagnosed an inguinal hernia, and mostly we perform laparoscopic technique for repairing inguinal hernias. We use 3 trocars to reach the groin area in the defect area. When we reach there, we will put a net over the defect inguinal site and we will finish the surgery. Surgery is around 45 minutes to 1 hour. The recovery after surgery is too faster according to the laparoscopy technique, but even it is faster, we recommend our patients light activities for the first week, and they will increase the activities step by step after surgery.
When is surgery recommended?
If an inguinal hernia is diagnosed, there is no medical treatment or there is no other treatment. For that reason, if an inguinal hernia occurs, we should recommend surgical repair for the patient. Even the patient is asymptomatic, it can be dangerous to live together with an inguinal hernia because sometimes strangulation and incarceration of the other organs into the hernia sac is possible. For that reason, the patients diagnosed with an inguinal hernia should be recommended to have this surgical treatment.